All right, guys, you remember this case? This was one of my favorite denture cases. Patient came in with this denture made at like the wrong vertical. It's literally 8 millimeters off on the vertical, and it just falls out of his mouth. I felt so bad for him. We made him a new denture, and guess what? We also converted him to an all-nex prosthetic up top. And so here he is, the way he presented. I tried to get that old denture to work for records, but I just really couldn't do anything with it. So we went back to the drawing board. And we used the thermoplastic technique to create new records at the proper vertical. Then I'm using the mod retractors to go ahead and scan. Here I'm using a hemi-arch scan technique where I'm scanning half the arch in completion, and then I'm scanning the other half. It's a really good technique, especially if you guys struggle with your soft tissue scanning. Here on the lower, I'm scanning for the partial denture. And again, just popping this into exocad and designing this prosthesis. Upper split file denture, lower flex denture. And we have so many tutorials on how to do this, it's not even funny. But I will say this, guys, it's about a 15 to 30 minute design for an experienced designer. And if you're learning, don't be surprised if it takes you 4 hours with lots of tears. But that's just the name of the game when you're learning. So now that we have the denture, I'm going to add a posterior palatal seal, add some selective pressure back to the border. And I'm going to go ahead and print this bad boy. Flex on the lower with apex flex, apex on the upper. And we're going to snap that in and check the occlusion, make sure our vertical is correct, look at the phonetics. And I'm going to let him wear it for 4 to 6 months before I convert him to an all-nex prosthetic, just to make sure everything is perfect. So here he is immediately after his denture delivery. He's like a new man, totally in love with the denture. And this is something that I think is really important. All-nex prosthetics should start with a really nice denture for your edentulous patients. Don't proceed forward unless you can make them a nice denture. So here we have the stackable guide. Although this is not a bone reduction case, we have these stackable pieces and a base guide that is seated with the occlusion of the denture. So here we bite down, we put our pins in, and then we do our osteotomies. In this particular case, we're using pretty aggressive implants from BioHorizons, and we're undersizing the osteotomies dramatically and hand driving in the implants. We only really did one drill sequence. We're placing 4.3 implants, 12 and around 12. They're all 12 millimeters long. We're in the guide, we kind of go all the way to bicortical stabilization almost with the several different areas. So we're really got profound torque here. We're about 50 to 70 on all the implants. And so we're looking really good. And we're ready for an immediate load. So once we get the drivers to link, we're also looking at timing so that when we put our MUAs in, they're already at the proper location. And that's indicated by a notch on the driver here. So here is the tool that we're putting in our MUAs. We're torquing to 20 Newton centimeters with those. We have 2 angled 17s in the posteriors and then straights for the rest. And the straights are easier to put on. The angles are a little bit annoying because you have to have another hex wrench distal to the access hole. Here's the soft tissue scan with the true abutment caps, and here is the true abutment T markers. This is sped up. It's actually about 1:50 in real time. And then we're going to go ahead and get the unified scan body scan out of there. That corresponds to the scan caps that we scan with the tissue caps. That's really important. So now we open up our denture design, and look what I'm doing. This is the kind of lazy way to design an all-nex. I just take that denture and I cut the palate out and I cut the flange off and I close the holes. And now I'm aligning all my intraoral scans on day of surgery to my preoperative denture scan. So, and the guide is actually used as the tracker. So now the scan body scan's aligned. So now we're exporting our lower, our upper, our tissue, and our scan body all aligned to the denture wax up. And we bring it into a new scene called anatomic wax up, screw retained, and we go ahead and align our scan bodies. And the software is just going to take that denture that I modified digitally in 3 seconds and cut the implant locations. And all I'm doing is making sure my tissue pressure is good, about 300 microns for non-flapped cases. And my thickness is good, my occlusion's good, and my prosthesis is flat and cleanable. And the whole all-nex design is about, 5 to 8 minutes. And then we're going to use sprint race plaid mode with the slam supports, print that thing in 13 minutes and screw it in. And here he is just a few days later. He's so happy. He honestly, this guy has been so appreciative. He's been a pleasure to work on. But the next stages for him are to let him heal, typically 4 to 6 months, and I'm going to go ahead and put him in a zirconia prosthesis. I don't have my temps break, even with that little cantilever there. Everything's all good, guys. Hope this case is something that inspires you, and maybe we could keep talking about how we do these techniques at the Mod Institute.